I apologize. So I'm just trying to get you guys back on. I have this real, oh no, did it go? Broadcast has ended. All right. Let's see. Am I still alive here? No, I guess I am still alive. So what the heck is going on? Are you guys there? Let me see if this works. Are you guys still there with me? I got one person there. Hello, one person. You're great. I'm thankful you're there. Maybe it's just me. Oh, I see. Let me get this. Public. Okay, we're going to try this again. Bear with me, guys. I'm having some technical glitches here. I just got kicked off, and I want to have this really important conversation about Ezekiel, Emmanuel, and the nursing homes and what happened in the nursing homes. I have a video I want to share with you and my show notes that I just posted. So hopefully I got you guys back on. I just unfortunately got kicked out of I just got kicked out of my live, not by any censorship for this particular one, but just a technical glitch. So bear with me here as I get it back up and running. I apologize for the snafu, but I want to talk about this really important story. It matters. It matters a lot. I want to dedicate this show today to my grandmother and to all the grandparents out there and to all the people that died needlessly in nursing homes, that died alone without their family members, that were treated like subhuman, not even like humans, not even, it's just horrendous what happened to the elderly in nursing homes during COVID. And as I understand it, it is still really hard to visit people in nursing homes, so I'm not 100% sure if that's accurate. I have to do a little research. I don't have any elderly family in any nursing homes right now, but this goes out to all the folks out there who have lost a dear loved one during this recent time. Somebody needs to be accountable. Somebody needs to be held accountable, and the media is not covering it the way that they're supposed to. Being that my experience in life is a lot to do with media, I have to cover this story and I have to talk about it. So I have a real important video that I want to share with you. So I spoke about yesterday, I covered Renee Coleman Mitchell, who was the head of the DPH. Now she is being scapegoated as the reason for the problem in the nursing home. And it's interesting because in New York State, Governor Cuomo put it into an executive order. It's very clear that Cuomo is responsible for the nursing home deaths, and he's holding back information. He's not allowing all the information to come out. Like, they haven't counted all the deaths of the elderly who were later transported to the hospital but got COVID in the nursing home because of his executive order. But where did those executive orders come from? Where are these policies that are so similar? And we could look throughout our country and we could see the same policies are all over throughout the whole country. Where is this coming from? Let's take a look at this character. This is Ezekiel Emmanuel. Let's see, hopefully this shifts over to you guys. I'm not seeing it come through. Hold on a second. Am I still having some technical glitches? Bear with me, guys.
What I am arguing about is not prolonging, not taking medications, not having surgery where the goal is to save your life, to give you more life. So I'm not going to do that.
Dr. Ezekiel Emmanuel outlined why he hopes to die at 75 in a provocative piece in this month's issue of The Atlantic.
I look at the data on disability, I look at the data on Alzheimer's disease, I look at the data on loss of creativity, and 75 seems to be the right moment.
I created The Honest Company to make life easier for all parents. Our diapers and wipes subscription allows you to customize your size and prints. Plus, you save when you subscribe.
Sorry about that, guys. Give me a second. I'm gonna get this back up and running. You're gonna see me in 1 second. I apologize for that. I just lost my my scene thing. It's just like annoying. So here I am. I'm back here. Apologize for that. That was Ezekiel Emmanuel. So his attitude is that at 75 years old, you're done. You're done. Your life is a waste. And he wrote this piece in the Atlantic. And he's also responsible for a lot of policy. And he is responsible for shaping that policy. And his attitude is that as you're older, you do not have the same rights. Like what he does is he created these models, and he wrote an extensive article, and you could see it in my show notes, where he wrote this extensive article about kind of putting people in these projections of who is more worthy of care and who is less worthy of care. And if you're over 75, according to Ezekiel Emmanuel, well, then your quality of life, no more doctors for you. No more care. Like if you needed heart surgery and you're like 75 and you could still have 20 years, because that can happen, yeah, you're not going to get heart surgery. You're taking up too much time and space. This is his policy. And in my show notes, you can find information about that. He wrote an extensive article back in 2008 about just that, where he talks extensively about how people should be rated for care. Like infants, they're not high on the ratio for care because they haven't had any life yet. So you're going to give more priority to an adolescent. I kid you not. This is this man's policy. So you can see in my show notes, you can go follow those links. You can read this stuff for yourself. And I'm going to read you some other things that this man, it's bizarre how he wants to do this stuff. So he's like talks about how people in certain categories have more right to care than others. I'm absolutely stunned. So Zeke, as they call him, that's like his pet name, Zeke. Zeke is also taking on the role of senior advisor to the director of the World Health Organization. So not only is he shaping policy in Connecticut, he's shaping policy globally. He is a technocrat. If you want to know what a technocrat is, Ezekiel Emmanuel is part of the technocrats. And it is his policy that is spearheading how these governors throughout the country are treating the COVID crisis. He was instrumental in creating Obamacare. He is instrumental in the policy that led to the nursing home debacle with all of that death. And Annie Lamont, he is partners with Annie Lamont at Oak HCFT. He is a partner in that venture capitalist firm, which is just mind-blowing and hard to believe that this guy this is just absolutely incredible. And just so he here's some of the things that he says. This is one of his quotes about the elderly. It renders many of us unaged. This is him speaking on age. It renders many of us, if not disabled, then faltering and declining. A state that may not be worse than death, but is nonetheless depraved. It robs us of our creativity and ability to contribute to work, society, the world. It transforms how people experience us, relate to us. We no longer are remembered as vibrant and engaged. Now we're feeble and ineffectual. That's Ezekiel Emmanuel. Annie Huntress Lamont attitude about nursing homes was they're too crowded. Get them out. That was in 2019. Where was she going to get all these people in nursing homes? Where were they going to go? How convenient that COVID wiped out a large portion of the elderly in nursing homes. 70% of all COVID deaths were in nursing homes. These characters are responsible for this policy. Ezekiel Emmanuel is sitting on the committee to reopen the state of Connecticut. I also want to read you his thoughts on immunity passports, Ezekiel Emmanuel. So he wants everybody to have an immunity passport. So he calls them immunity licenses. And here's some of his ideas about having this. An immunity license can be consistent with priority to the least advantage. That is, people who are medically, socially, or economically vulnerable. Under strict public health restrictions, no one would be able to perform in-person social and economic activities. Conversely, if some activities are made conditional on licensure, only people who lack immunity license may be disadvantaged. Here's a man that doesn't think you deserve care when you're 75, because when you're 75, you're all done. He also has boxed people into categories of what is the best, who deserves health care, who gets the health care. So Ezekiel Emmanuel, I want to put him in your consciousness, and I put a bunch of notes there for you guys, and I'm going to close out on that little note. It's just a little short stint to kind of just get the, I'm doing a deeper dive into that. I want to share some more videos of this guy with you. He is just incredibly scary and awful. I wonder if it's possible if I can get this up for you guys right now. Let me see if I can share this last video before I turn this off, because I want you guys to think about these people. Who are these people? So he has another video. This is a technology video where he is talking about, and I have terrible internet, so I apologize if I bust out of here again on you.
I've got good news.
Let me get the commercial off there. So he is instrumental in the policies that are affecting our lives. This particular guy, it's just insane. So Ezekiel Emmanuel, I want you to take a peek at this video. I'm going to share this for you right now. Here we go. Let me get here.
Huge problems in the system is, we used to discharge patients and give them a stack of prescriptions to go get filled and take, right? And we know that 70% of the time people actually fill the prescription that the doctor gives them. And then only 70% of the time, once they have the medicine, do they actually take it right.
Really?
So now you're down to 50% compliance. And then they have to take it every day, typically, ad infinitum. And, that falls apart. So we have better systems now for compliance. We have tops to the medicine bottles that have little LED lights, and if the patient hasn't taken it, it stays red. If the patient has taken it, it goes green. And if by 11 o'clock the patient hasn't taken it, a wireless message goes to their doctor and a wireless message goes to their family. It also a wireless message once they've taken it when it gets low and they need a refill. All of those things are important. So compliance in that kind of area gotten much better because of technology. And by the way, I think we're going to have, this is one area where people talk about, well, the Affordable Care Act is going to undermine innovation. This is one area where you're going to have a big explosion in innovation, figuring out how to monitor people, how to increase compliance, how to get them to do things that we want them. I think that's a huge area where we're going to see just so many new products, so many new apps that are going to just help the system. And again, help integrate so that what people are doing at home is something that the doctor can know or the hospital can be able to monitor much more closely over time. Remember, most of us go to the doctor, or even if we have a chronic illness, spend time in at the physician or at the hospital, a very small fraction of our lives. Most of what we do is out of the four walls of healthcare institutions. Yet that has a huge impact on our health, huge impact on healthcare spending. And so we're going to need a lot more ability to monitor that, to help patients, again, change their habits, to integrate healthier behaviors into their lives.
So that was Ezekiel Emmanuel talking about healthcare innovation. And let me just close that out. So that's Ezekiel Emmanuel talking about healthcare innovation and this great technology that can help you remember to take your medication and alert your doctor in the hospital and the government. He may not be talking about it as he's, promoting these ideas, because that's not going to work, right? People aren't going to go for that. Who on earth is going to go for that? Nobody. So here he is saying this stuff where it sounds good, right? What could go wrong? But let me just, before I end this little show, because this is a short one today, I'm just so blown away by this guy. And all of this is in the notes, and you guys can go in there and check this out. I just want to read you something that this guy wrote back in, I want to say, 2008 or 2009. And this is by Ezekiel Emmanuel. It's called Principles for Allocation of Scarce Medical Intervention. And for anyone who's just tuning in, Ezekiel Emmanuel's policy or idea is that when you're old, 75, you've lived long enough, you're going to be feeble and not creative, and there's nothing left for you. Maybe you're going to write some poetry, or you're going to, have a little hobby, but you don't deserve any life-saving care anymore after 75. Ezekiel Emmanuel is now 76 himself. I wonder if that policy applies to him. I'm just curious. Okay, so let me just read you just a little bit of this, and you can go read this entire thing that he wrote, because he uses models and charts. So pay attention when these scientists and these industry experts start talking about models and observations, because that's not gold standard science. Models and observations are not gold standard science. Gold standard science is randomized controlled trials, double-blind placebo studies. Gold standard science is the ability to always ask questions, to debate, to never squash the debate, which we are seeing that in our mainstream media. We're not getting a full scientific debate on any of this stuff. All we get are characters like Ezekiel Emmanuel, whose idea is that when you're 75 years old, you're done. You don't need any care. You don't need to go to the doctor. You don't need anything. The one thing I do agree with, he's like, at 75, you don't need a flu vaccine. That's a good idea. I wouldn't get a flu vaccine. That's just me, my opinion. You can take it or leave it. That's okay. I don't do flu vaccines at all, period. But it was the one bit of advice that said, well, that actually helps seniors, in my opinion. You can make your own opinions and do the research and come to your own conclusions, which I think everyone should. So let me just read you this. Allocation of very scarce medical interventions, such as organs and vaccines, you can leave the vaccines, but whatever, you get the picture, is a persistent ethical challenge. We evaluate 8 simple allocation principles that can be classified into 4 categories. Treating people equally. Equally. What does he mean by that? Because he's not being equal here, okay? Favoring the worst off, maximizing total benefit, and promoting and rewarding social usefulness. What does that mean? Promoting and rewarding social usefulness. So is grandma not useful anymore? Is your grandma not useful? Are our elders no longer useful? Really? We've had periods in history where this type of thinking has happened before, and it didn't turn out pretty for anyone. I mean, I can't even believe that this guy is saying this. No single principle is sufficient to incorporate all morally relevant considerations, and therefore individual principles must be combined into multi-principle allocation systems. We evaluate 3 systems: the United Network for Organ Sharing Systems, Quality Adjusted Life Years. I'm going to stop there. Quality Adjusted Life Years. Not only does he cattle up all us commoners, because this isn't for the 1%. Ezekiel Emmanuel's in the 1%. He's talking about us. He's not talking about him. He's 76 years old right now. I bet you if that guy needed medical care, he'd take it. He wouldn't just go die. If he had a heart attack tomorrow and needed to have intervention, he would do it. So when he says this stuff, he's not talking about him. He's not, no. And this is Annie Lamont's good friend and business partner, Ezekiel Emmanuel, who is also assisting the head of the WHO. Okay, his hands are in everything. He helped Obama write Obamacare, and there were some scary things in Obamacare. I'm sorry, folks. It wasn't a good healthcare plan. It's not. That's not the answer to our problems. It really wasn't. That's a technocrat's wet dream, actually. There were parts in there where they were stopping people from getting care, and you would have to go through this bizarre program that would have bypassed Congress and would allow these private entities to decide who deserves your care. So Ezekiel Emmanuel, who sits on the committee to reopen our state, who is a policy shaper for the country, for the world, globally, is a technocrat and an elite in the elite 1% class. Because this is what we're up against. It's not about Republican, it's not about Democrat. It is about the ruling class, and you can see all these problems are happening all over the place. It's not about party. It definitely is coming from more, the party that's in power right now is Democratic in Connecticut anyway. So, but it's an establishment thing. It really is. We have to get them all, because they'll come in, and if they're in that upper echelon of people and policymakers, we're just commoners to them. They even have a thing where they call us like the commoners. It's just nuts. So I just want to finish this point before I get all off of my topic. Principles of allocation of scarce medical interventions. Who gets to decide whether your grandma gets to live? Whether your child, if you have a baby and your baby needs surgery and there's something that's scarce, they're going to maybe say no, or they say scarce. Who says it's scarce? According to whom? Who decides? So how do you put all these human beings into these little categories like this and then play God? Humans don't get to play God. Just because you have power and money that gives you the power to play God doesn't mean you should. But they do, and this is historical. This is the type of thing that's always happening through time immemorial. The United States was unique in the respect that, and still is unique, that we have a Bill of Rights and a Constitution, freedom of speech, freedom to decide what goes into your body, freedom to pursue life and happiness as you see fit. But that is slowly changing, or fastly changing, how, in this day and age, and has been eroding for quite some time. And these are very dark times. So Ezekiel Emmanuel, I'm going to end it there because I got all over the place. I didn't mean to do that. And I will see you guys later. Ezekiel Emmanuel, please go check out the show notes. Go read that study, the article that he wrote about how he's going to class us all up and who gets what, who gets to live, who gets to die, and how he's going to manage your health care. And what they want is to have technology monitoring us and dictating to us how we can live, because Ezekiel Emmanuel wants immunity licenses, and he thinks that once you're 75 years old, you're not worth it to be on this, to get any care. So can you imagine that? At 75, you're feeble-minded and you have no more creativity. Really? I mean, all of us grow old. That shouldn't be something that is a curse upon you. Who is he to decide? Does money make him God? Who is he to decide? Is that even fair or right or just or morally good? That some rich guy in the ruling class, because that's what he is, Ezekiel Emmanuel, partners with Annie Huntress Lamont, Oak, HCTFT, look it up. Annie Huntress Lamont was caught saying that she'd like to see the nursing homes empty out or lessen. They don't want them. They don't want them. They don't want to care for the old. They want to get rid of all that. Just let's exterminate them, probably. I wonder, hey, what happened? The policy killed thousands of elderly people, and it connects through all the states, and I'm going to go and do more coverage on this and more looking into this, but it just makes sense. It, you know, people say that Lamont is following Cuomo. No. Cuomo's following Annie Huntress Lamont. Annie Huntress Lamont is 1% elite ruling class with an $8 billion company that she founded, which made its billions off of healthcare. Annie Lamont is the brains behind the Lamont administration, and it is all her buddies and all her business partners that affect the nation and the globe. Ezekiel Emmanuel is global and national. He wrote Obamacare, was very instrumental in writing that. He didn't write it all, but he was very instrumental. He's advising the WHO before COVID. Took time off from his regular job, which is like some global health company. I'm sorry, the name popped off my head, but he did help the WHO in 2019, and he is currently on the committee to reopen our state. And he wants us to be locked down until a vaccine, so think about that for a while. Yeah. Ezekiel Emmanuel, please go check out those notes. Tell me what you think after you go see for yourself. Question everything. Everything. Question it all.